Welcome. Gene therapy is transforming how we treat disease, but could it also turn back the clock and buy you more time? A new clinical trial claims it can reverse aging, but it will cost you $1 million to participate. Kansas-based company Libella Technology is sending participants to Colombia to undergo gene therapy that aims to lengthen telomeres. These are these structures at the end of our chromosomes that protect DNA during cell division, similar to caps on the end of our shoelaces. But telomeres shorten each time a cell divides, and some believe the shorter the telomeres, the faster we age. So does this sound too much like science fiction? And is it ethical to charge $1 million for a chance to sip from that fountain of youth? So should we and can we cure aging? Molecular biologist Dr. Bill Andrews says we can and we should. He joins us in the audience, and his opposition, bioethicist Dr. Craig Klugman, joins us via Skype. Want to thank both of you so much for being here. Fascinating topic. Bill, I want to start with you, just in terms of how you have aligned yourself with this gene therapy clinical trial and why.
Well, I've been interested in finding the cure for aging ever since I was 10 years old when my father first put the seed in my head. For about the last 25 years, I've been focused on trying to understand the role that telomeres play in the aging process. And as a result, I've invented this technology now that it's being used in this study, and I also wrote the clinical protocols that are being used in the study.
Your view on this is that you kind of consider aging to be a terminal disease, correct?
I do consider aging to be a terminal disease. For instance, a typical healthy 89-year-old actually has an 11% chance of dying before they turn 90. That's actually pretty terminal to me. Also, the people in this study, their risk of not being treated will be far greater than the risk of being treated, especially people that are old, like 89 years old, 90 years old.
Well, Bill, what catches us all by a little bit by surprise is the price tag to be part of a trial.
Well, paying to be in the trial is one of the options, but that is actually, in fact, the cost of doing the trials. When you add up all the costs of preparing the gene therapy, we've done a lot of studies to figure out how much we actually need to actually stand a good chance of reversing aging, the cost of doing all the testing, all the doctors, all the hospital costs. We're doing 150 different biomarkers of aging during the study. This comes out to be $1 million. That's the cost to my company or the company that's doing actually the clinical study.
Bill, have we done animal studies yet? What have you found in animals?
A sufficient number of my studies have been done. We have provided the technology to labs all over the world, and it has been successfully shown to be able to reverse aging in mice in every way imaginable.
So I want to bring you, Craig, into the conversation because you say not so fast. You have some major issues with this trial, if you will. Can you explain your stance on this as a bioethicist?
My first concern is that aging is not a disease, right? It is a stage of life. It is a part of life. And so looking at it as a disease, as something that needs to be cured, I think really does not give due justice to this part of life. I also have a great concern over this idea that people are going to be paying to be part of a clinical trial. This is not a standard way we do trials. Does a person who pays this kind of money truly have the freedom to go, you know what, I think I've changed my mind, I'm walking away? We also know that this is possibly potentially very harmful for the subjects taking part. We've had people die from earlier stages of genetic trials of this sort. There have been tumors that have been created and cancers that people have come from being part of these trials. So I'm concerned about all that. I'm also concerned about the social justice issue. $1 million isn't something I have in my bank account, and I'm sure most of you don't either. Is this where we should be putting our emphasis as a society on giving very wealthy people the ability to live a longer life while other people go without food and clothing and housing and education, which are the things we know help most people live longer, better lives?